Hey everybody, so this is a video on how to mix whether you have B12 or NAD or any growth hormone or growth hormone peptides or anything that needs mixing. And this will be a video on how to do that. Okay, so quickly, you would have gotten like your box, like with your medication in it, whatever the name said, depending on the different, and it would have a little instruction here. Let's say mix with 10 mLs of dilutin and inject 100 units on insulin syringe once a week. So this is the instructions for this one. So this is talking about the B12. So in here came these two little vials. So some pharmacies will give you a when you have it, you'll have one vial with a powder, and then some will give you the exact amount of liquid that needs to be mixing, and others will give you a big big jar like this. So we'll have that, and then there should be a mixing syringe. So this is a 3 ml mixing syringes, and it's usually they try and give you a 10 ml, so it'll be a big one, and I'll have like a needle in it. Now, just in case they don't give you or they forget or something like that, I'm going to show you guys how to mix it with one of these syringes as well, one of these insulin syringes. Okay, so just for a quick reference, so it says here mix with so it says here mix with 10 mLs of diluent. Okay, so diluent means in this case we'll say either bacteriostatic water or diluent. Okay, and that's this one. So what we're going to do is we're going to pop this little cap off here. Okay, and then pop this cap off here. So this is the B12 here. Okay, and then this is the bacteriostatic water. So in this case, we have this syringe which has 3 mLs in it. It says it goes up to 3. And what I tell everybody to do is just tighten this top. Just make sure it's secure, the needle, and then pull up to 3 mLs of air. Okay, then what you want to do is just upside down, push, and then push that air in, so you create some back pressure. It makes it easier to draw out. Now with a big vial like this, you're going to be okay, but just in case, so you pull up to the 3 mark here. I don't know if you'll be able to see, just right there. Okay, and so we know we're putting 3 right now, so we need to mix 10, but we have 3, and you see there's naturally a vacuum, so even without pulling, a lot of these will have vacuum pressure. So I already going to know to pull in some liquid. So now that's 3. Now we're going to do another 3, and that will make 6 right now. So let's get 6. And I forgot to put some air in, but and I felt a little pullback pressure there. Now another 3. All right. You can see it's still pulling. I'm not even doing anything. It's naturally pulling it. The vacuum's there. Okay. Another one. No. And then I forgot once again to pull air, but just in case, if you feel pressure and you can't pull, you see it's pulling it back kind of, so I know that it needs I need to put a little bit of air into it. Okay, so I pulled up another 3 here. Okay, see, I pull back. Okay, there we go, and that's now is a total of 9, and we gotta do 1 more, and boom. Okay, and then 1 more. So you're gonna pull up 1. We just need 1, so put some air into it. Boom, and pull back. Okay, perfect. Now this is 10 ml, so we have put 10 mLs. And now, what it means, now with for example, in this case, if like usually with growth hormone or something, it'll say like either 1 ml or say 7.5, so 7.5 mLs. So you're gonna put, this is 3, or if 10, you just pull up to the 7.5 mark. In this case, you pull up to the 3 mark, 2, and a 6, and then do a 1.5. Okay. Now, say for example, they forget to give one of these syringes. Okay. Sorry, somebody's calling there. So they give one of those syringes. 100 units. If you can see on here, 100 units equals 1 ml or 1 cc. 1 cc, cc and mLs are the same thing. So in this case, it would be tiresome, but you would pull up literally, and let's put some air into it. We would pull up 10 times. So we'd pull up 10 of these over and over, right? And we would inject it into this vial. Okay. But in this case, since we did the full 10, it would be fine. Now, in this case, with this one, so this box here says inject 100 units, inject 100 units on insulin once a week. Okay, so in this case, every insulin syringe, even if it says 50 or it goes up max 50 or whatever, 30 or 100, all the respective units will be the same. So 30 on a 50 syringe that goes up to here, the 50's down here, it would be the same as 50 on here, just so you have a clear idea on that. Now, in this case, what I always tell patients is same thing that, remember how we filled up this with this bactericide when we put some air into it? By the way, you can discard this now. You don't need this anymore. Every time that you're going to inject, I tell everybody to just pull up some air into it, okay? Put some air, and then now you can draw. Now, one thing I forgot to do, which I should mention, is after you put the liquid in here, just mix it in between your hand like that. Okay, boom, done. All right, and then just pull up the put some air in, and you see, but you know, B12 mixes pretty quickly. So some of them you will have to just roll it in between your hand. Don't shake it. Mix. Okay, so all right, and then just put in. Draw up the liquid after you put the air in, and there, boom. And then now you have your B12 ready to be injected. So once again, just going to recap everything for everybody. I don't need that anymore. Once again, I'm going to recap everything for everybody here. When you get your vial, first, what you're going to do is separate out, pop the little lids off of the respective vials. Then on your mixing syringe, if you have a 10 ml syringe, a 3 ml syringe, or if you don't have any and you have these 100 unit syringes, okay, you're going to have to inject the amount that is said on the box. So sometimes it'll say 7.5. In this case, it says 10 mLs. So in this case, you're going to draw up 10 mLs. Boom. From this, filling air into here, putting air in here. It'll make it easier to draw, and then fill it up into the vial. Okay. Afterwards, anytime you're going to be about to inject, just pull up with air into this. Okay, I hope this helps clear up any misconceptions or anything that you do not understand. Okay, thank you. Bye.